Okay, good morning, students. See, this is the pick of great heroine, late Sridevi, is the superstar of Bollywood from Telugu industry. Next, you see here, she is the weightlifter from Manipuri, sorry, Impal. And Chanu, her name is Mary Bai Chanu. She is a weightlifter and is a Padma Shri and gold medal. She won gold medal winner in weightlifting. Next is the person, all of you know very well, I think, is the CM of Telangana. And he is another person, ex-CM of Uttar Pradesh, Akhilesh Yadav. And he is the KCR, okay, Chandrasekhar Rao. What is the specialty of all these four people? You observe. First, you see here, don't see on her ornaments. Okay, just you see face, and within the face, especially nose is straight, and there are some rumors. She underwent rhinoplasty, that is plastic surgery to the eye. And you see here also, she belongs to Northeast state, Chanu, Mary Bai Chanu. She's a weightlifter, and you see here her nose. Okay, not gold medal. Huh? Okay, you see nose, and it is different from the Sridevi's nose. You see our Telangana CM KCR is also specially identified by his nose. And another ex-CM, you see here, his nose. Okay, these are all the different shapes of noses. To our today's topic, nose. That is, we are going to discuss today about the nose. That is external nose. What is the external nose? And what is the nasal cavity? What are the boundaries? What are the structures forming the roof of the nasal cavity? And what are the structures forming the base of the nasal cavity? And medial wall and lateral wall. Okay, these are all the things we are going to discuss today. And in our clinical practice, what is the importance of all these structures in our day-to-day clinical practice? How they are related with our patients, doctors, and clinical practice. These things we are going to discuss today. In the last class, already we discussed about another special sensory organ, that is the eyeball. First, I have to say sorry, because in the eyeball, in the last 5 or 10 minutes, hurriedly I completed because of lack of time, and it is a vast topic. More number of subdivisions in the eye. Because of this, in the last, due to lack of, already next class teacher is waiting. Okay, that is why I completed in the ST manner. Okay, I think I hope you can understand my problem. Okay. Next, today we are going to discuss about the nose. And here, nose, it contains external nose and nasal cavity. External nose and nasal cavity. And external nose, it is a pyramidal projection on the face, and it gives beauty to the face. Beauty to the face, and it is having free tip or apex. We call it as free tip or apex. This one, okay. And next is the root. That is, it is connected with the frontal bone, connected with the front. This part is called root of the nose, and this is called tip of the nose. Tip of the nose. And in between the root and the tip, and this part of the nose is called dorsum of the nose. This part is called dorsum of the nose. Dorsum of the nose. You see, this is the tip of the nose, and this is the root of the nose. In between these two, this is the dorsum of the nose. Dorsum of the nose. These are the parts. And an anterior part of this nose, there are openings. These are called nostrils. They are called nostrils. And posteriorly also, the nose is opened into the nasopharynx with the help of another opening, They are called cone. They are called, you see, what is posterior opening, what is anterior opening, all these things. Basically, the upper, that is the external nose, it is formed by bones and cartilages, and it is also some part by the fibrofatty tissue. These are three components which are taking part in the formation of the external nose. That is the first, bones. That is, what are the bones? That is nasal bone, frontal process of the maxillae, nasal notch of the frontal bone. These are all the bones, and lower part by upper and lower lateral nasal anterior border of the nasal septum and alar cartilages. Finally, it is also made up of fibrofatty tissue. These are all the structures. They are taking part in the formation of the framework of the external nose. External nose. Okay, you see, and here this is the total is the external nose. This is the root of the nose, and these are the nostrils, and this is the tip of the nose, and this part is called dorsum of the nose. The external nose, it is also receiving its blood supply from the surrounding blood vessels, especially that is, you see, this is the dorsal nasal artery. Dorsal nasal artery, it is a branch from the ophthalmic artery, that especially infratrochlear branch of the ophthalmic artery, that is the dorsal nasal artery. It supplies to the upper part of the external nose, and it also receives a blood vessel from the infraorbital, and it is a branch from the maxillary artery. It is a branch from the maxillary artery, and these are all the branches they supply to the external nose. And it also receives blood vessels from the facial artery. Facial artery, that is in the form of angular artery, and another one is the septal branch, that is from the superior labial branch. Superior labial branch of the facial artery gives a branch to the septum of the nose. So these are all the blood vessels which are supplying to the external nose. That is, first one is the dorsal nasal artery. It is a branch from the ophthalmic artery, and there is an infratrochlear branch, and infraorbital branch. It is a branch from the maxillary artery, and it also supplies to the external nose. And next is the angular and septal branches of the facial artery. Angular and septal branches of the facial artery. These are all the three arteries. That is the ophthalmic division of the ophthalmic artery, maxillary artery, and facial artery. These are the three major arteries. They are supplying to the blood supply to the external part of the nose. Okay, next. Nerves. What are the nerves which are supplying to the external nose? What are the nerves which are supplying to the external nose? That is, you see here, this is the infratrochlear branch of the ophthalmic nerve, and infraorbital branch of the maxillary nerve, and that means this ophthalmic, maxillary, and mandibular. There are the three divisions. They are from the trigeminal nerve. Here, out of these three, first two, that is ophthalmic and maxillary divisions, they are supplying to the external nose, and the external branch of the anterior ethmoidal nerve. These are all the nerves which are supplying to the external nose. Okay. Next, coming to the, what is the extent of the nasal cavity? Nasal cavity. Already we have seen external nose. External nose, it is anteriorly it is limited by nostrils, and posteriorly by the corona. This is called corona. The posterior limit of the nose nasal cavity. Anterior limit of the nasal cavity is called nostril, and posterior limit of the nasal cavity it is called corona. It is called corona. And what are the structures which are taking part in the formation of the nostril? We see first. First, nostril, it is formed by cartilages, and it also supported by the fibrofatty tissue. The nostrils, that is the entry point of the nose. These two are called nostrils. This entry point of the nose, they are called nostrils. They are supported by cartilages first. Next, medially, it is made up of cartilages. What are the cartilages? That is medially by the mobile part of the septum, that is in the form of septal cartilage, and laterally by the U-shaped alar cartilages. These are the very important cartilages because they are U in shape. They are like this, U shape, and because of this only, that is a nostril or an entry point of the nose gets patent. It is open. It maintains this patency or opening of the nostril. It is maintained with the help of the U-shaped alar cartilage. U-shaped alar cartilage. See, these are the structures, they're taking part in the formation of the nostril, boundaries of the nostril. Next, coming to the posterior limit. You see here, first we see about the nostril. You see here, this is the, these two are the nostrils. This is one nostril, this is another nostril. Okay, and here it is boundaries. This is the lateral boundary, this is the medial boundary, and this is the medial boundary by in the form of nasal septum or medial wall or nasal septum. It is formed by septal cartilage. Septal cartilage. Inside this, there is a septal cartilage. It is forming the framework for the or basis for the formation of septum, nasal septum. That is, and this is the lateral wall. Lateral wall, it is they are called alae. They are also called the lateral wall of the nose. Lower part of the nose or lateral wall of the nostril is also called alae. Alae of the nose. They are called alae of the nose. Okay, this is the ala of the nose, and here it is formed by alar cartilages. Alar cartilages, they are U-shaped cartilages. Because of presence of the alar cartilages, the patency of the this nostril, patency of the cavity. Okay, entry point of the nose, it is maintained with the help of the alar cartilages. Okay, clear. Next, coming to the here this alar cartilage, it is a just entry point of this nostril. It is provided with a coarse hair, and these coarse hair, they prevent or they filter the air which is entering into the nasal cavity, and they filter the coarse particles, foreign particles from the inhaled air. That is why this coarse hair in the nostrils, especially this part is called the vestibule. We discussed what is vestibule, all these things. Okay. This is the coarse hair at the entry point of the nose. Okay. Next, coming to the conae. That is the conae. These are the posterior limb. Cona is singular and conae is the plural. Okay. This is the posterior limit of the nose. Posterior limit of the, this is the one side and this is the another side. This is the right side. This is the left side. These are the posterior limits. What are the bones which are taking part in the formation of the conae or cona? That is the posterior limit of the nose. That is, you see here, these are the cona. Okay, and here these are formed by bones. That is the sphenoid body of the sphenoid bone and vomer, and this is the hard palate. Below it is formed by hard palate, and laterally by the body of the sphenoid, and this is the lateral pterygoid plate. Sorry, medial pterygoid plate. Medial pterygoid plate. These are all the boundaries. They are taking part in the formation of the cona or posterior boundary of the nasal cavity. Posterior boundary of the nasal cavity. The posterior boundary of the nasal cavity, it is about 1.5 centimeter, 1.25 centimeters. That is the transverse diameter, and 2.5 centimeters vertical diameter. 2.5 centimeters vertical diameter. See here. This is the 2.5 centimeters means 25 millimeters, and 12.5 millimeters, that is 1.25 centimeters. That is vertical is 2.5 centimeters and 25 millimeters, and transverse is 12.5 centimeters. Millimeters, sorry. Oblong in shape. The shape of the external, that is a posterior layer, is called is oblong in shape, and it is bounded by bones. It is bounded by bones. Here, the nostril is bounded by cartilages. And but the conae or cona, it is bounded by bones. What are the bones? That is the posterior free margin of the vomer, medial pterygoid plate, and body of the sphenoid, and posterior margin of the hard palate. Posterior margin of the hard palate. These are all the bones. They are taking part in the formation of the cona or conae. Okay, these two are the conae. One is the cona. Okay, these are all the bones. That is the extent of the nasal cavity, from anteriorly from the nostril to the posteriorly to the cona. In between these two, so here the length of the nasal cavity is about 7.5 centimeters. 7.5 centimeters from the tip of the nose up to the posterior limit, that is up to the cona, is about 7.5 centimeters. 7.5 centimeters, and maximum breadth is maximum breadth is it is 1.5 centimeters. 1.5 centimeters. Maximum breadth is 1.5 centimeters. The length of the nasal cavity is about 7.5 centimeters. Okay, that is the nasal cavity extension. Okay, and nostril, what is nostril? What is cona? Next, coming to the nasal cavity proper. Nasal cavity proper. The nasal cavity, it is divided with the help of the median nasal septum into two halves. Two halves. The nasal cavity is divided into two halves with the help of the median nasal septum. Median nasal septum. Okay, divides the nasal cavity into two halves. That is right and left halves. Usually, the median nasal septum, it is deviated to one side, towards one side. That is normally towards the right side. Normally, the median nasal septum divides, it is deviated towards the right side, and it makes the nasal cavity into two unequal halves. Unequal halves. Okay, that is the two halves of the nasal cavity. Nasal cavity is divided into two parts. That is two halves. That is the help of the nasal septum. Usually, the nasal septum is deviated to one side, most commonly towards the right side, and so it divides into two unequal halves. Okay. Next, the nasal cavity, it extends from the, already you know, that is from nostrils to phonae, and each half of nasal cavity presents what are the boundaries of the nasal cavity. Okay, that is very, very important. Clinically, these boundaries of the nasal cavity is very, very important for the, especially for the ENT and head and neck surgeons. Head and neck and face, there is dental surgeons and head and neck surgeons. So what are the boundaries of the nose? It is very, very important. You see here, first it is for roof over the nose. There is a roof, and next is the floor, and medial wall, that is nothing but the septum of the nose or median nasal septum, and it is a lateral wall. Okay, these are all the four boundaries of the nose. We see in detail about the each and every boundary of the nose. That is what are the structures which are taking part in formation of the roof of the nose, and what is its importance, clinical importance. All these things we discuss. Next, we go for the floor, and what are the bones which are structures which are taking part in formation of the floor, and what is its importance. Next, medial wall and lateral wall. And lateral wall, it is very, very important clinically and your examination point of view also. The lateral wall of the nose is very, very important apart from septal wall. There is the median nasal septum is also important, but lateral wall is very, very important. We discuss one by one. Okay. Next, coming to the roof. It is very narrow from side to side and consists of three parts. The roof of the nasal cavity consists of three parts. What are the three parts we see? First one is the frontonasal part. This part, what we are seeing in the front, this is the roof of the nose, and this part is called frontonasal part. Frontonasal part. It is directed downwards and forwards. Directed downwards and forwards. And next is the intermediate part or ethmoidal part. Ethmoidal part, and it is about 2 to 3 millimeters wide. And the posterior part, that is called sphenoidal part, it is about 8 millimeters in width. 8 millimeters in width. What are the different parts? What are the structures which are taking part in the formation of these three parts? We discuss one by one. Okay. Next, coming to the first part, that is anterior part or frontonasal part. So you see here, this is the section of the lateral wall of the or middle of the nose. Middle of the nose. If you take the section like this, you are able to see all these structures. Okay, in the midline, these are the structures in the midline. That is in the hair, this line. Okay, in the midline, this is the anterior part or frontonasal part. Anterior or frontonasal part. Here you see these are the structures. They are taking part in the formation of this frontonasal part. That is the nasal spine, the frontal bone and nasal bone and cartilages. That is the nasal cartilage, lateral nasal cartilage and alar cartilages. Alar cartilages. These are the parts that are taking part in the formation of the roof of the frontonasal process, part of the roof, and it is directed downwards and forwards. Directed downwards and forwards. That is the direction of this roof. That is especially the anterior part or frontonasal part of the roof of the nose. Next, coming to the another part, intermediate part. This part is called intermediate part. From here to here, this part is called intermediate part. It is formed with the help of the bones. Okay, you see here. Here, this is intermediate part, and it is formed by an important bone, that is the ethmoid, cribriform plate of the ethmoid. cribriform plate of the ethmoid wire. Why it is called cribriform? Cribri means sieve-like. It is having multiple pores. Multiple pores. What is the reason for multiple pores? Because this is the area for the olfactory mucosa. From this, the olfactory nerve ending starts, and they pierce this cribriform plate, that is ethmoid bone, and it makes like a sieve-like, and at the same time, the ethmoidal arteries also pierce this bone, and the total all these structures, they make the bone into sieve-like. That is why it is called cribriform plate of ethmoid bone. And this is the area, it is taking part in the formation of the roof of the nasal cavity, especially the intermediate part of the nasal cavity. Intermediate part of the roof of the nasal cavity. So next, coming to the posterior part. Here, this part of the nasal cavity, the roof of the nasal cavity, clinically it is very, very, very important. Okay, because here this nasal, that is olfactory nerves, they're coming, they're making like a sieve, and this part of the bone, it is very delicate. It's very delicate. Whenever there is an accident, road-traffic accidents, there are more chances for the fracture of the base of the skull. Fracture of the base of the skull. Here, this part of the bone, it is taking part in the formation of the front, that is a anterior cranial fossa. Anterior cranial fossa. The frontal lobe comes in contact with frontal lobe of the brain, comes in contact with surface, and below the frontal lobe there is a subarachnoid space. Subarachnoid space. It is covered by there is a meninges, and if there is a fracture of this cribriform plate of ethmoid bone, or sometimes there may be chances for the fracture of the body of the sphenoid bone also. They may cause damage to this meninges, and it may produce a clinical condition, that is leaking of cerebrospinal fluid, CSF, through the nose, and that condition is called CSF rhinorrhea. CSF rhinorrhea means that is the coming watery discharge from the, that is a running nose. Running nose is called rhinorrhea. If the fluid is CSF, cerebrospinal fluid, that is called CSF rhinorrhea. And this is very, very important clinical condition, because directly the meninges and subarachnoid space and brain, they are coming in contact with the external environment through this fracture site. And because of this reason, there is chances for the spreading of infection from the external area or from the nose into the meninges, and the person may develop meningitis. The person may develop meningitis or encephalitis. Because of this reason, this cribriform plate of the ethmoid bone, especially the part of the intermediate part of the roof of the nose, clinically it is very, very important. At the same time, from this area, the olfactory nerves, they are entering from the olfactory mucosa to the front, that is into the bulb, olfactory bulb, and while they passing this area through this cribriform plate, they may surrounding these, there is a chances for this small lymphatics, they may enter, and through this also the airborne infections from the viruses, airborne viral infections, they may also spread into this CSF and brain, and they may produce meningitis. Okay, because of this reason, this intermediate area of the roof of the nose, clinically it is very, very important. Very, very important. Okay, next coming to the another part, that is the posterior part of the nose. Posterior part of the roof of the nose. It is formed by anterior surface and inferior surface of the body of the sphenoid. Here, this is the sphenoid bone, and this is the sphenoidal air sinuses. Sphenoidal air sinuses. This is the anterior part, and this is the inferior surface, anterior surface, and this is the inferior surface. These are also taking part in the formation of the posterior boundary of the roof of the nose. Okay, clear. That is about the roof of the nose. And here the anterior part, it is the most commonly, it is area, it is fractured during any road traffic accidents or during any fighting, fighting, and this boxing or some other fighting. There is a chances for the fracture of these bones. Okay, that is about the roof. Next, coming to the floor. What are the bones which are taking part in the floor of the nose? What are the bones which are taking part in the formation of the floor of the nose? The floor of the nose is smooth and concave and much wider than the roof. roof is, it is only about 3 to 8 millimeters. The breadth of the roof is 3 to 8 millimeters depending upon the area. And here, but the roof, if you come to the floor, it is wider, more wider than the roof, and concave, and it consists of soft parts of the external nose. Here, this part, soft parts, and mostly it is formed by palatine process of the maxilla and the horizontal plate of the palatine bone, which are together form the hard palate. That means some small part it is formed by the, here you see here, this is the section of the nose like this. To take the section like this, okay, this is the anterior part, it is formed by cartilages and soft part, soft tissue, fibrofatty tissue, and this is the posterior part. This total posterior part, it is formed by hard palate. Hard palate, already you know that is hard palate. It is formed by two bones. That is a palatine process of the maxilla, this one, and this is the horizontal plate of the palatine. This horizontal plate of the palatine bone and palatine process of the maxilla together they form the hard palate. And here this is the concave. A hard palate, the superior surface of the hard palate, is taking part in the formation of the floor of the nasal cavity. Floor of the nasal cavity. Okay, these are the structures, and it is concave from side to side. It is concave. It is concave from side to side. Okay, these are the structures that are taking part in the formation of the floor of the nasal cavity. Next, coming to the another boundary, that is the nasal septum or medial wall or nasal septum. Okay, here the nasal septum, it is formed by bones and cartilages, and anterior most part is formed by fibrofatty tissue, but only very small part, and mostly it is formed by cartilages and bones. Okay, among bones there are principal bones and accessory bones. Principal bones and accessory bones. Accessory bones mean only some part of the bone it is taking part in the formation of the nasal septum, and principal bones mean they are the main bones. They are taking part in the formation of the nasal septum. Nasal septum is like this. Vertically is like this. Okay, and here what are the principal bones? That is a perpendicular plate of the ethmoid bone and vomer. Perpendicular plate of the ethmoid bone and vomer. These are the principal bones that are taking part in the formation of the nasal septum. And next is the accessory bones. What are the accessory bones? That is nasal spinal of the frontal bone and sphenoidal crest and rostrum and the horizontal parts of the palatine bones. These are the accessory bones. They are taking part in the formation of the nasal septum. Okay. Next, what are the cartilages? That is septal cartilage, septal process of the lower nasal cartilage, and sometimes omoronasal cartilage. These are all the cartilages which are taking part in the formation of the nasal septum. We see here in the picture. You see here, this is the nasal septum. Okay, nasal septum, and this is the cartilaginous part. This part is the cartilaginous part, and this is the bony part. Okay, these are the bones. You see here, this is the nasal bone and perpendicular plate of the ethmoid and septal cartilage, and this is the vomer. Okay, and this is the sphenoidal rostrum. Okay, sphenoidal rostrum, and this is the sphenoidal crest. Anterior part there is a ridge that is called sphenoidal crest. These are all the bones, and here this is the palatine bone, and this is the palatine process of the maxilla, and these are all the bones that are taking part in the formation of the nasal septum, and these are the cartilages which are taking part in the formation of the nasal septum. Okay, sometimes, okay, you see here, sometimes there is a chances for the extra cartilaginous part in between these two. Okay, see, this is the perpendicular plate of the ethmoid bone, and this is the vomer. Okay, this is the nasal cartilage, and this is the alar cartilage. Okay, here in between these two bones, okay, here in between the this septal cartilage and the vomer, sometimes there may be some additional cartilage. This is the omoronasal cartilage, and here it is well developed. Here at this area there is a one pouch-like structure that is called omoronasal organ of Jacobson. Omoronasal organ of Jacobson. It is mostly developed, more developed in the lower animals, that is like rabbits and dogs. That is, they are macrosomatic. Macrosomatic animals. It is omoronasal organ of Jacobson in between the septal cartilage and the vomer. It is like a pouch that is called omoronasal organ of Jacobson. Okay, here these are the bones and cartilages which are taking part in the formation of the nasal septum, and it is lined by mucosa. Nasal septum is lined by mucosa, and only some anterior part is here. This only this part. This part is called vestibule. This part only it is lined with the skin. The remaining part it is lined by mucous membrane. The remaining part is lined by mucous membrane. Only anterior small part is lined by skin, and it contains mucus. There is a hair. That is coarse hair. Okay. Next, what are the blood vessels which are supplying to the nasal septum? What are the blood vessels which are supplying to the nasal septum? That is the antronasal part, and antro superior part. That is by the anterior ethmoidal branch of the ophthalmic artery, anterior ethmoidal branch of the ophthalmic artery, and postero-inferior part by the sphenopalatine and greater palatine branches of the maxillary artery, and mobile part of the septum. That is the anterior most part. Anterior most part, it is by the septal ramus of the superior labial branch of the facial artery. So, three arteries, that is ophthalmic artery branches, maxillary artery branches, and facial artery branches. These three artery branches together they are supplying to the blood supply to the arterial supply to the nasal septum. Okay, and there is another important point, and among these three branches, the arteries, they together they form one special area in the nasal septum, that is nothing but the Little's area or Kesselbach's area, and it is an area on the antero-inferior part of the septum. It is highly vascular. With the help of the anastomosis between the important branches of the three arteries which are supplying, that is ophthalmic, maxillary, and facial artery branches. Together they form a specialized area in the antero-inferior part of the nasal septum. That area is called Little's area or Kesselbach's area. The way it is called, why it is having its importance means clinically this area is very, very important because it is the anastomosis between the septal branches of the facial artery, long sphenopalatine artery, anterior ethmoidal artery, and greater palatine arteries. GASS. Okay, you see here, Little's area, Kesselbach. How to remember what are the arteries which are taking part in the formation of the or anastomosing at the Little's area? That is, first is the greater palatine artery. It is a branch from the comes from below. That is greater palatine artery, especially the anterior branch, and anterior ethmoidal artery, and sphenopalatine artery, and superior labial branch of the facial. GASS. Okay. Actually, this is the long sphenopalatine. And for the mnemonic purpose, we are writing like this. That is the gas. GASS. Greater palatine artery, anterior ethmoidal artery, septal, that is sphenopalatine artery, and superior labial branch of the facial artery. These are all the arteries which are taking part in the formation of the Kesselbach's area or Little's area. This is the circled area. This is called Little's area. You see here, this is the sphenopalatine artery. This is long sphenopalatine. Actually, you call it as long. This is the short, and this is the long sphenopalatine artery is taking part. And from the anterior ethmoidal artery, and this is the septal branch of the facial artery. Superior labial branch. From the superior labial branch, there is a septal branch, and this is also taking part. And from below, there is another artery, that is a greater palatine artery. These four arteries together, they form the anastomosis at this area, that is at the antero-inferior quadrant or antero-inferior part of the nasal septum. And this area is called Kesselbach's area because this is the area most commonly it produces dangerous clinical condition that is called epistaxis. That is means nasal bleeding from the nose. Bleeding from the nose is called epistaxis. This is if there is any small injury or any small ulcer in this area, it may produce profuse bleeding because this is the arterial anastomosis. Arterial anastomosis, it may produce profuse bleeding. That is why this Kesselbach's area or Little's area, clinically it is very, very important. Clinically, it is very, very important. Okay. Next, what is epistaxis? We discuss later. Okay, we'll discuss in clinical anatomy. That is about the Little's area and blood supply to the nasal septum. And this is the venous drainage. That is anterior superior part drains into superior ophthalmic vein, and posterior inferior part drains into pterygoid venous plexus, and mobile part of the septum into the internal jugular vein through the facial vein. And here in this area, this already we discussed. We will discussing about the face, venous drainage of the face. That is, it is having connection with the deeper veins. Because of this reason, any infection in this area, and that is the lower part of the nose and upper lip, and this area is called dangerous area of the face. Dangerous area of the face, because it is connected with the pterygoid venous plexus, and this pterygoid venous plexus, it in turn is connected with the cavernous sinus. Because of this reason, this is the clinically it is important. And the upper part of the inferior cerebral, upper part of the nasal septum drains into the inferior cerebral veins. And here sometimes there is maybe big veins in this area. That is especially in the upper part of this nasal septum. They are communicated with the superior sagittal sinus. And there is suppose in some patients, especially the elderly people who are suffering with the uncontrolled hypertension. If due to increased in hypertension, there is a chances for the rupture of the blood vessels which in the cranial cavity and the brain. In that occasion, due to increased intracranial tension, there is a chances for the rupture of these veins, the venous communications between the superior sagittal sinus and the superior, that is inferior cerebral veins, which are communicated with the upper part of the nasal septum, and it may rupture to prevent the intracerebral leaking of blood. That is this procedure. This is called safety valve mechanism. If there is no rupture of this, may produce epistaxis, that is bleeding from the nose. If there is no such a mechanism, there are chances for the damage to the blood vessels which are in the cranial cavity. That is a clinical importance. Next, lymphatic drainage from the anterior part of the submandibular, that is from the anterior part of the nasal septum into the submandibular group of lymph nodes, and from the intermediate part and posterior part into the retropharyngeal group of lymph nodes. And from the upper part, from the few lymphatics, they may accompany the olfactory nerves, and they may drain into the CSF. And through these draining points from the lymphatics, there is chances for the spreading of infections, especially the airborne viral infections. They may spread to the cranial cavity, and they may produce meningitis. That is the clinical importance of the subarachnoid spaces in communication with the upper part of the drainage of the lymphatic drainage of the upper part of the nasal septum. Okay. Next, nerve supply of the nasal septum, that is olfactory zone, that is 15 to 20 bundles of olfactory nerves convey the smells. There is a special sensory, that is from the olfactory nerves, and the remaining zone, that is general sense, it is by the ophthalmic, maxillary, and trigeminal. These are the two divisions of the trigeminal nerve. Okay, that is the nerve supply. Next, coming to the other important part, that is the lateral wall of the nose. Okay, already we discussed roof of the nose, floor of the nose, and medial wall or nasal septum. Okay, last one is the lateral wall of the nose. This is also very, very important clinically, because it is having relation with some important structures on the sides. That is why the lateral wall of the nose, clinically, it is very, very important. And even examination point of view also, the lateral wall of the nose, it is where they may ask for the 8 marks, 5 marks. Now 5 marks are, sometimes they may ask for the essay also, so, along with the paranasal aid silences. That is why you must be very careful. The lateral wall of the nose is irregular. Presence of 3 shelf-like bony projections, they are called conae, or singular concha. Conae or concha. And the conae increase the surface area of the nose from effective air conditioning of the inspired air. What is the most important function of the nose? There is nothing but the air conditioning of the air, inspired air. That is by adding humidity or adding temperature, depending upon the external environment. And it also takes part in the filtration of the air. That is, foreign noxious substances or some dust particles, they may be catched in the nasal mucosa with the help of some special provision. We discuss what are the special provisions in the nasal mucosa. All these things we discuss. The most important function is air conditioning of the inspired air. That is the most important function of the nasal cavity. Okay. Next, the lateral wall separates the nose from the surrounding structures. There is the nasal lateral wall of the nose. It separates orbit from the above from the orbit with the ethmoidal air sinuses, and maxillary sinus from below. This is the maxillary sinus from below, and from the nasolacrimal groove or nasolacrimal duct. Lacrimal groove and nasolacrimal duct from front. Okay, these are the, you see here, this is the specimen, lateral wall of the nose. And here you see, this is the roof of the nose, and this is the anterior part, this is the intermediate part, and this is the posterior part. Okay, this is the lateral wall of the nose. These are the conae or concha. They are called concha. Okay, these are the concha. They make the lateral wall of the nose irregular. And these are all the parts of the lateral wall of the nose. Next, the lateral wall of the nose is subdivided into three parts. The lateral wall of the nose is subdivided into three parts. That is, first one is this part is called the entry point. The part of the cavity of the nose which is lined by skin. It is lined by skin and provided with hair, coarse hair. That part of the nose is called vestibule. And just posterior to this vestibule and this area, this dilated area, it is called antrum. This area is called antrum, and the remaining posterior is the real nasal cavity. Okay. You see, here it is a conae. Vestibule, that is the anterior small depressed area, and antrum of the middle meatus, that is the middle part, and posterior is the posterior conae, that is the posterior part. The posterior part just posterior to the conae. You see here, this is the vestibule, and this part is called antrum, that is the extension of the middle meatus, heading of the middle meatus. This is the antrum, and the remaining part, the total posterior part, this is called conae. This part is called conae. These are the three parts of the lateral wall of the nose. Next, what are the structures? And here, all these three parts, they are lined by only vestibule. That is the anterior part. It is only lined by the skin. It is provided with the hair. The remaining two areas, that is the middle part and posterior part, these two are lined by mucosa. They are provided with a specialized epithelium, that is a ciliated columnar epithelium, pseudostratified ciliated columnar epithelium. That is the special mucosa of the posterior and the middle part of the lateral wall of the nose. And what are the bones or skeletal framework of the lateral wall of the nose? We see it is the skeletal framework of the lateral wall of the nose. It is partly bony, partly cartilaginous, and partly made of soft tissue. The soft tissue, that is a part, it is taking part in the formation of the vestibule of the nose, and antrum is mostly it is the formed by cartilaginous part, and bony part, that is the conae. The conae are made up of, they are supported by bones. These are all the parts of the lateral wall of the nose. You see here, this is the vestibule, and this part is called antrum, and the remaining part is called conae. Okay, the remaining part is called conae. Okay, and these are all the conae, concha. That is, this is the inferior concha, middle concha, superior concha, supreme concha. It may or may not present. Okay, next, what are the bones which are taking part in the formation of the lateral wall of the nose? That is, first is the nasal bone, next frontal process of the maxilla, lacrimal bone, superior and middle concave of the labyrinthine part of the ethmoid. Labyrinth of the ethmoid. And inferior nasal concha, it is a separate bone. Superior and middle concha, they are part of the ethmoid bone, but inferior concha, it is a separate bone. And perpendicular plate of the palatine, perpendicular plate of the palatine bone, and medial pterygoid plates. These are all the bones which are taking part in the formation of the lateral wall of the nose. We see, I show you diagram also. And next, cartilaginous part, that is superior nasal cartilage, inferior nasal cartilage, and alar cartilage. Superior nasal, inferior nasal, and alar cartilages, they are taking part in the cartilaginous part of the lateral wall of the nose. Lateral wall of the nose. The bony wall, it is formed by nasal bone, frontal process of the maxilla, lacrimal bone, superior and middle concave of the, that is, they are part of the labyrinthine part of the ethmoid bone, and inferior nasal concha is separate bone, perpendicular plate of the palatine bone, and medial pterygoid. And cartilaginous part is superior nasal cartilage, inferior nasal cartilage, and alar cartilage. Okay, it is formed by the next critical part, that is the anterior-most part. It is formed by fibrofatty tissue and covered with the skin. Covered with the skin. Okay, these are all the parts of the. Here you see, these are all the bones which are taking part in the formation of the lateral wall of the nose. Okay, these are all the bones. You see, this is the medial pterygoid plate. This is the middle and superior concha. They are formed by ethmoid, that is a ethmoid bone, labyrinthine part. And this is the inferior concha, it is a separate bone. And here you see, this is the frontal process of the maxilla, and this is the nasal bone. And these are the cartilages, that is the lateral process of the septal cartilage and alar cartilages. And these are all the parts that are taking part in formation of the bones and cartilages in the formation of the. And here anterior most part, this part is critical, that is a line, it is formed by fibrofatty tissue and lined by skin. Okay, these are all the different parts of the lateral wall of the nose. And next, the lateral wall of the nose, it is divided into three parts. That is with the help of the bony projections. They are nothing but the cone or concha, that is superior concha, middle concha, and inferior. The curved bony projections directed downwards and medially. The curved bony projections directed downwards and medially from the lateral wall of the nose. That is, there are three projections usually, that is superior, middle, and inferior nasal concha. Sometimes there will be supreme concha also present, but usually there are three concha, that is superior, middle, and inferior concha. And below this, suppose if it is like this, the concha is like this, and below this area, this is a space. This space is called meatus. This the space below the passage beneath the overhanging concha, they are called superior meatus, middle meatus, and inferior meatus. Below the superior concha, there is a superior meatus, and below the middle concha, middle meatus, and below the inferior concha, inferior meatus. Okay, these are all the three spaces. You see, these are all the concha, that is inferior, middle, superior concha. Sometimes there will be supreme concha. Okay, and if you remove this concha, these are all the meatuses. These are all the meatus. This is the inferior meatus, this is the middle meatus, this is the superior meatus. Sometimes if there is a presence of the supreme concha, this is the supreme meatus. Okay, these are all the meatus. These meatuses are very, very important clinically because the paranasal air sinuses, they are opening into these meatuses, and they are pouring the secretions into these sinuses. And there are sometimes they are intercommunicated. Because of this reason, clinically these are very, very important. Meatuses are very, very important. First, you see about the inferior meatus. This is the inferior meatus. Into the inferior meatus, there is opening of the nasolacrimal duct, especially the anterior part of the inferior meatus. There is a opening of the nasolacrimal. Already we discussed. We are discussing about the lacrimal apparatus. There is a nasolacrimal overflow lacrimal fluid. There is the tears. They go into the nose, especially into the anterior part of the inferior meatus. Next is this is the middle meatus. That is the part of the space beneath the middle concha. And here the inferior nasal concha, it is a separate bone. And the posterior extremity of this inferior nasal concha, it is just 1.25 centimeters anterior to the pharyngeal opening of the auditory tube. This is nothing but the pharyngeal opening of the auditory tube surrounded by tubal tonsil. And just 1.25 centimeters anterior to this one. This is the posterior part extremity of the inferior concha. Okay, next this is the middle concha. Below this is the middle meatus. Within the middle meatus, there are two important structures. That is, this part is called ethmoidal bulla, along with the openings of the middle ethmoidal sinuses, and this is called hiatus semilunaris. Hiatus semilunar. Why it is called semilunar in shape? Hiatus means opening, and this is a semilunar in shape. That is why it is called hiatus semilunaris. This hiatus semilunaris, it is these two are very, very important. They may ask for the 3 marks question. They may ask for the middle meatus. They may ask for the 5 marks. And emphysema, there is a ethmoidal bulla and hiatus semilunaris. They may ask for the short answers. And here into the hiatus semilunaris, you see here this is another structure. There is a ethmoidal infundibulum. Ethmoidal infundibulum. Into the ethmoidal infundibulum, the frontal air sinus opens through a canal. Sometimes it may present or may not. That is directly they may open into the ethmoidal infundibulum. That is if there is presence, that is called frontonasal duct. Frontonasal duct. So the frontal air sinus, anterior ethmoidal sinus, middle ethmoidal air sinuses, and this is the opening of the maxillary sinus. Maxillary air sinus. Maxillary air sinus. So these are all the sinuses. They open into this ethmoidal. There is a middle meatus. Middle meatus. Okay. And here this is this anterior part of this middle meatus. This part is called antrum. This part is called antrum. Okay. Then just you see two important points. That is this middle meatus. It is above. It is limited by a mucus ridge. Mucus ridge. This is called agar nasi. Agar nasi. And the vestibule, it is above. It is limited by another. There is a ridge that is called Lyman nasi. Lyman nasi. This is the agar nasi. Next, this is the middle meatus. Next, coming to the superior meatus. Into the superior meatus, there is opening of the posterior ethmoidal sinuses. And if there is a presence of this supreme meatus, it also the posterior ethmoidal sinuses they also open into the here. And next, just this posterior superior concha, it is occupying above the middle meatus, especially the posterior half of this middle meatus. Above this, there is a superior concha, and the space behind the superior concha. This area is called sphenoethmoidal recess. Sphenoethmoidal recess. Into the sphenoethmoidal recess, there is opening of the sphenoidal air sinuses. Sphenoidal air sinuses. That is why these are all the air sinuses. They are opening into the lateral wall of the nose. Because of this reason, the lateral wall of the nose, clinically, it is very, very important. Next, these are all the meatuses. They are opening into the different. We will go through this one. Okay, already we discussed. Next, these are all the meatuses. Next, what are the blood vessels which are supplying to the lateral wall of the nose? That is anterosuperior quadrant. If you divide the lateral wall of the nose into 4 quadrants, this is the anterosuperior, anteroinferior, posterosuperior, posterior-inferior. And these are all the blood vessels which are supplying to the lateral wall of the nose. That is the anterior ethmoidal artery to the anterosuperior quadrant, anteroinferior quadrant by the alar branch of the facial and lateropalatine artery, posterior superior quadrant by the sphenopalatine artery, and posterior inferior quadrant is by the greater palatine artery. Okay, these are all the arteries which are supplying to that is they are nothing but the branches from the ophthalmic and maxillary and facial artery branches. Okay, next venous drainage, that is it forms the plexus, and here the veins which are draining the lateral wall of the nose, they from the plexus and they drain into the facial vein in front and retropharyngeal vein and the pterygoid venous plexus behind and into the inferior cerebral veins above. Inferior cerebral veins above. And lymphatic drainage into the submandibular group of lymph nodes. Okay. Next, coming to the nerve supply, that is there is special sensory by the olfactory nerve. Here, the olfactory area, that is about 2 square centimeters. The olfactory area is in the superior, posterior part of the nose, a roof of the nose, 2 square centimeters area. It is occupied by the olfactory zone. It is occupied by the olfactory zone. That is the area for the nerve endings of the olfactory nerve. Olfactory nerve. And general sensory by the anterior superior part by the anterior ethmoidal nerve and anterior inferior part by the superior alveolar nerve, anterior superior alveolar nerve, and posterior superior by the posterior lateral nasal branches, and posterior inferior by the anterior palatine branch. You go through all these things. And there is the secretomotor and the vasomotor fibers are also supplying to this lateral wall of the nose. That is secretomotor from the pterygopalatine ganglia. This is the ganglion of hay fever. Hay fever. That is that is responsible for the running nose. Running nose, it stimulates the vasomotor fibers which are supplying to the lateral wall of the nose, and it produces continuous discharge from the nose. And that is from the third and fourth thoracic segments, that is the sympathetic fibers that are coming to the lateral wall of the nose. And here the epithelial lining of the nose, it is very, very important. Nasal cavity is very, very important. The vestibule, it is lined by, it is slightly dilated. You already know what is the vestibule. It is like lined by skin, and it is provided with coarse hair, sebaceous and sweat gland. Sebaceous and sweat gland. The coarse hair and stiff hair filter the foreign particles. That is the first line of defense. First line of defensive mechanism of the body. That is, while inhaling the air, first the hair, it filters the coarse particles from the inhaled air. After that, the air enters into the second part, that is the respiratory part. Respiratory part, here the respiratory part of the nasal mucosa, it is also specially arranged, provided with a special arrangement, that is in the form of ciliated pseudostratified columnar epithelium. This lining mucosa, it contains ciliated pseudostratified columnar epithelium. It is provided with additional, that is goblet cells, mucus cells, serous glands, and serous gland, and they are also provided with cilia. And these are very, very important, because here the pseudostratified ciliated column, it is having cilia, and goblet cells and mucus cells, they produce the mucus, and it acts like a sticky material. Sticky, suppose if you see, this is the season, if the flies comes to the light in our house, what do? We apply oil to the one paper and just hang to the tube light or some other area, and the insects, they stick to this oily surface, and that is same mechanism in our body. Here, the goblet cell secretions, they secrete the mucus, and the mucus glands also secrete the mucus, and together they line this respiratory mucosa of the nose, and at the same time, it is trapped. The dust particles are trapped by the mucus. At the same time, the ciliary rejection current, that is ciliary movements, they push these dirty particles towards the posterior way, and once the dirty particles, they comes in contact with the posterior surface of the nose, and that is the pharynx, it produces coughing or sneezing reflex. In that way, it is eliminated out. That is the protective mechanism. That is the second line of defensive mechanism. First is the filtration of air with the help of the coarse hair. And next, the serous glands are also present. These serous glands are playing most important role. This is the mucosa. It is provided with there is a ciliated columnar epithelium. And here at the same time, the lamina propria, there is an important that is erectile tissue, erectile vascular tissue present in the nasal mucosa. This erectile vascular tissue, it is normally collapsed. It is having connection with the arteries and veins. Whenever there is stimulation of this erectile tissue, it is loaded with blood, and it produces secretions into the nasal cavity. And at the same time, this is one clinical condition that is called vicarious menstruation. Usually, menstrual bleeding comes out through the uterus, through the vaginal cavity. But here, in some individuals, some females, there is chances for the nasal bleeding during menstrual period. That is due to, because this erectile tissue of the nose, it is regulated by the sex hormones which are circulating in the blood. Because of this reason, that is called vicarious menstruation. Vicarious, that is abnormal menstrual bleeding. That is during menstrual bleeding, there is a bleeding of nose. That is the one clinical condition. Next, coming to the olfactory region. There is olfactory region. There is only small area. There is 2 square centimeters area in each half of the nose. That is, it is yellowish in color, and it is provided with bipolar neurons, olfactory neurons, and columnar supporting cells and basal cells and supporting cells. And here, these columnar cells, these basal cells, they may replace. Here, in general, usually there is no replacement of the nervous tissue once it lost. But here, this is the special zone. There is a chances for the replacement of this olfactory nerves with the help of the basal cells. That is the most important area. And what are the functions? That is olfaction, air conditioning, and filtration of particles. Next, these are all the clinical conditions which are related with the nose. That is a DNS, not dextrose normal saline. It is a deviated nasal septum. Deviated, that is usually deviates to one side, that is called DNS. With the septoplasty, you can correct the DNS. And the rhinitis, that is inflammation of the nose due to it produces running nose. And CSF rhinorrhea, already I discussed, that is due to damage to the base of the skull, especially the cribriform plate and body of the sphenoid. It may produce damage to the meninges, especially damage to the dura and arachnoid matters. It may lead to leaking of CSF through the nose. Here, the most important point of the CSF rhinorrhea is you have to aware the patient, avoid contamination of this running CSF through the nose, because if you touch the unsterile that is the cut sheets or cotton like this infection may spread directly into the brain and it may produce meningoencephalitis. Because of this reason, you must be very careful with the CSF rhinorrhea. Next, nasal polyps and foreign particles. Nasal polyps, that is the mucosal growths, and foreign bodies, that is more common in the children's. They used to put the peanuts or slate pencils into the nose, and this is the most common problem with the children's, that is foreign bodies. Once there is a foreign body enter into the nasal cavity, you must be very careful. You have to remove the foreign bodies with a proper instrument. Don't handle the foreign bodies with the, without proper equipment, because there is a chances for that they may dislodge in the posteriorly and they may go into the trachea or larynx. It may obstruct the respiratory passage, especially in children. It is very narrow. The respiratory trachea is very narrow. Because of this reason, you must be very careful with the foreign bodies of the nostril. Next, vicarious menstruation, already I discussed. There is the due to erectile presence of the erectile tissue in the lamina propria of the nasal mucosa. They are regular. These functions of this erectile tissue, they are under control of the sex hormones, and that is during menstrual cycle the chances for the bleeding of the nose, that is called vicarious menstruation. And anosmia, that is the loss of smell sensation. This is most common in the people who underwent some drugs, especially I personally experienced, because I took treatment for the cancer, that is chemotherapies. Okay, during that time I lost my sense, that is a smell sensation. Finally I recovered, no problem. Okay, that is my personal, even now also I am unable to smell some smells. That is due to loss of this olfactory mucosa because of this chemo drugs. Okay. Next, another important one is the adenoids. That is nothing but the growth of this lymphoid tissue in the posterior part of the nose, and they may produce obstruction to the breathing. And in that occasions they go for the that individual may go for the oral breathing. That is the problem with the adenoids. Next, epistaxis, already we discussed, that is due to ulcers of the nose, or sometimes it may be rupture of the veins of the nose also. That is called epistaxis. Epistaxis, it is the most common in dry weather and summer weather also. It is especially it is more common in the children. But sometimes it may be due to rupture of the blood vessels, that is arteries or veins, and sometimes it may be confusing. Suppose if the patient is lying down, the epistaxis blood may go into the throat and it may comes out from the that is mouth. Okay, that is why you have to differentiate whether it is epistaxis or it is epistaxis and coughing of blood, that is hemoptysis, and vomiting of blood, hematemesis. You have to differentiate as a clinician. Okay, these are all the clinical conditions. And during epistaxis, better to apply the pressure. Allow the patient to take oral breathing. And during epistaxis, they put some what you call some aids, that is a cotton or some that is just like rolls. There are rolls. You have to apply this antibiotic with this rolls. Then only you have to apply. Okay, these are the clinical conditions which are related with the. You see, this is the deviated nasal septum, and this is the deviated nasal septum after septoplasty. This is the right. Next, this is the cribriform plate of the ethmoid bone, and this is the body of the sphenoid. It is having relation with the intermediate part. If there is any breakage in this area, the CSF may leak through this one. That is another important thing. This is the nasal polyp. This is the mucus growth from the nose. And next is this is the adenoids. This is the adenoid. Already we discussed about the Walde's ring. Out of this superior part of the Walde's ring, it is occupied by this pharyngeal tonsil. That is nothing but if there is any growth in the pharyngeal tonsil, we call it as adenoids. It may cause obstruction to the nose in the posterior part. Next, these are all the clinical conditions. So, in general, this nose is very, very important. They may ask for the essay, that is a lateral wall of the nose and paranasal senses. And they may ask for the 5 marks, that is a lateral wall of the nose and breath supply of the nose. Or they may ask for the 3 marks, that is a little's area. And these are all the important topics related with the nose. Okay, already we discussed all. That is what is the nose, what is external nose, what is nose nasal cavity, what are the boundaries of the nose, what are the structures forming the roof of the nose, what are the structures forming the floor of the nose, and medial wall and lateral wall of the nose. Okay, all these structures and what's its clinical importance. All these things we discuss. Okay, we go through today only, then only we are able to remember. If any doubt, we discuss, never mind. Okay, thank you very much.